What are the types of antidotes used in toxicology? Antidotes can be classified based on how they neutralize or counteract toxicants. Chemical antidotes react directly with toxins, for example, sodium thiosulfate for cyanide. Pharmacological physiological antidotes oppose toxic effects, for example, atropine blocks muscarinic receptors in organophosphate poisoning. Chelating agents bind metals for elimination, for example, EDTA for lead. Antibodies specific immunological antidotes like antivenoms. Selection depends on the toxicant, timing, and species. Not all poisonings have antidotes, making early decontamination and supportive care essential. What is the importance of decontamination in toxicology? Decontamination is the first line of defense to reduce further absorption of a toxicant. Methods vary by route. Oral exposure. Induce vomiting, if safe, gastric lavage, or administer activated charcoal. Dermal exposure. Wash skin with soap and water to remove toxins like pesticides. Ocular exposure. Rinse eyes with saline or water. Early decontamination significantly improves prognosis, particularly in acute poisoning cases. Timing is critical. Intervention within 1–2 hours yields best outcomes. What are the limitations of using LD50 in toxicology? While LD50, lethal dose for 50% of test subjects, is widely used to assess acute toxicity, it has key limitations. It doesn't reflect chronic or sublethal effects. It overlooks species-specific responses. It provides no info on behavioral or reproductive effects. Ethical concerns arise due to mortality-based endpoints. Hence, regulatory toxicology is shifting toward alternative methods, such as NOAEL, in vitro models, and computational toxicology, aligning with the 3 R's principle: replacement, reduction, refinement. What is environmental toxicology and its veterinary relevance? Environmental toxicology studies how pollutants impact animals, ecosystems, and indirectly, human health. Veterinary relevance includes monitoring pesticide runoff affecting aquatic species, evaluating heavy metal contamination in grazing lands, assessing dioxins and PCBs in milk or meat. For example, fluoride contamination in water can cause skeletal fluorosis in cattle. Vets play a key role in surveillance, early detection, and advising policy on safe agricultural practices. What is the 3 R's principle in toxicology? The 3 R's stand for replacement. Use alternatives to animal models, for example, cell cultures, simulations. Reduction. Use the minimum number of animals needed to obtain valid results. Refinement. Modify procedures to reduce pain and improve welfare. This principle guides ethical toxicology research, improving scientific validity while upholding animal welfare. For example, using zebrafish embryos or high-throughput in vitro screening can replace some traditional rodent tests. How do toxicants affect reproduction in animals? Reproductive toxicants can cause infertility, for example, zearalenone disrupting estrus cycles in pigs. Embryotoxicity or fetal loss, for example, nitrate toxicity in cattle. Birth defects, for example, vitamin A overdose in pregnant animals. Hormonal disruption from endocrine disrupting chemicals. Such effects impact both productivity and population health in wild and domestic species. Reproductive toxicology studies help safeguard breeding programs and conserve endangered populations. What is residue toxicology and why is it important? Residue toxicology examines chemical remnants of drugs or toxicants in animal-derived food products, meat, milk, eggs, etc. These residues may cause allergic reactions in consumers, antibiotic resistance, chronic toxicity. Example: tetracycline residues in milk can cause hypersensitivity in children. Monitoring withdrawal periods and using proper dosage schedules help prevent violated residues. Regulatory bodies set maximum residue limits, MRLs, to protect consumers. What is the role of toxicovigilance in veterinary practice? Toxicovigilance is the systematic monitoring and reporting of toxic exposures in animals, akin to pharmacovigilance for drugs. It helps detect emerging toxicants, for example, melamine in pet food. Track regional poisoning trends. Alert authorities and manufacturers to prevent outbreaks. A robust toxicovigilance system improves animal health, public safety, and informs risk communication strategies. It also supports One Health by linking human, animal, and environmental toxicological surveillance. What is subclinical toxicity? Subclinical toxicity refers to toxic effects that do not manifest obvious clinical signs but still impair physiological functions. For instance, Chronic low level of aflatoxin exposure may reduce feed efficiency and immunity without visible illness. Lead poisoning in cattle might cause mild anemia or decreased fertility without overt symptoms. Detection requires biochemical tests, organ function markers, or histopathology. Recognizing subclinical toxicity is essential in herd health programs and long-term productivity assessments. How can toxicology support One Health initiatives? Toxicology is a cornerstone of One Health, as toxicants frequently cross boundaries between animals, humans, and the environment. Examples include zoonotic poisonings, for example, rabies bait toxicosis. Foodborne toxin transmission, for example, aflatoxins. Vector control chemicals affecting biodiversity. Pesticide runoff harming aquatic ecosystems. Veterinary toxicologists work at the intersection of public health, ecology, and animal care, making them vital collaborators in multidisciplinary responses to environmental and food safety threats.